Hi, I'm Dr. Kritika Agarwal, MD Pediatrics. I am a consultant pediatrician in Columbia Asia Hospital, Sarjapur branch. So lots of parents have so many questions when they start feeding the child. The most important things that we need to do would be, first, do not force feed. What we normally say is do responsive feeding. That means you as parent decide what, where and when you feed, and the child decides how much the child would eat. Do not force feed at all, because it becomes very stressful for the baby and in the long run does not help at all. Whenever you are introducing a new food, try to give it with the food which the child has already eaten before and likes. In case if your child is just rejecting the food, it is fine, let it be. Be patient. There are studies which say that kids can actually reject 5 to 15 times food before they finally start eating it. So we can give them a bit of time. If they are taking it in the mouth, they are just rolling it around and spitting it as well. Just be patient. Wait for some few days, approximately 7 to 10 days, and then you can reintroduce that food after some time again. So patience is the key. The other things that you have to take care would be the meal time. Do not extend more than 20 to 30 minutes. It should not happen that you are feeding the baby for 1 hour, 1.5 hours, showing screens, showing televisions, not at all recommended. So if you have fed the baby has taken, is fine. If baby is not taken, just leave the baby for some time. The other thing that you have to do is the snacking in between the meals. The snacks should not be high calorie sugary foods, because that kills appetite and in the long run is not good. So if you have to give any snack, it has to be some fruit or some vegetable sticks which the child can take, so that it will not hamper the appetite later on. There are other things as well that you need to kind of see. One other thing would be toddlers, as they grow, are very picky. They have a appetite which varies. So sometimes they'll eat less, sometimes they'll eat more. One thing they'll eat more, the very next day they may not eat it at all. So that is normal. So do not worry about it. So just let them be. Involve them in the feeding. So as your child grows, start giving finger foods. So we start finger foods somewhere around 8 to 10 months. Give finger foods which the child will take and it dissolves in the mouth. So that helps in the habit of chewing as well. And when we give finger foods and the baby starts eating, self-eating is something that you have to encourage. They will mess around, but it is normal. They are learning. Let them mess a bit. So in the long run, they will become more and more independent. Toddlers are the age when they wanted to become independent. So you have to encourage them so that they are able to feed themselves as they go. Do not try to become too much picky about giving these things only. Give variety of fruits, give a balanced diet. Do not do demand cooking. That means if your child has not eaten something and requests for something other, do not keep on doing that. That makes and gives the baby a very wrong message. The other thing that we usually say is try to keep a gap between major meals. Do not keep feeding every 2 hours. Then rewards should not be given to complete a food, because then the child thinks that this food is something which is not good, and the other things that you give as reward like chocolates or biscuits or cookies, they start preferring those. So that should not be done. Meal times should be a happy time. So try to give a positive environment to the child and encourage them to eat by themselves. Self-eating is something in the long run will really help your child. They would mess initially, but then they are learning. Be patient and encourage them to feed by themselves. And as more you involve them in the feeding, the easier it will become for you in the long run. So these are few things that you should follow and try to do when you are feeding.